Did you know that the body contains hundreds of bean-sized organs that are critical to fighting off infections? These organs are known as the lymph nodes, which are the principal lymphoid organs of the body. The lymphoid organs work in conjunction with the lymphatic system to provide a structural basis for your body's immune system. The lymphatic system is a network of tissues and organs that help rid the body of toxins, wastes, and other unwanted materials. The primary function of the lymphatic system is to transport lymph, which is a fluid containing infection-fighting white blood cells throughout the body. As a healthcare professional, it is critical that you all understand the structure and function of the lymph nodes so that you can properly check for signs of infections in your patients. During infection, the lymph nodes, which are usually unnoticeable, will become swollen and tender and are easily felt or palpated on the patient's body, especially in the neck region. A solid understanding of the anatomy and physiology of the lymph nodes and other lymphoid organs will enable you to properly evaluate your patients for signs of infection. The lymphatic system returns fluids which are leaked from the blood vessels back into the blood and consists of three primary parts. First, the network of lymphatic vessels known as the lymphatics. Second, the lymph, which is the fluid found in the vessels. And then finally, the lymph nodes, which help to clean the lymph. The lymphoid organs and tissues provide a structural basis for the immune system by housing phagocytic cells and lymphocytes, and aid in the immune response and help to combat infection. Structures include the spleen, the thymus, the tonsils, the lymph nodes, and other lymphoid tissues. Take a minute to look at the picture on the right-hand side of the screen to help yourself identify different lymphoid organs and tissues. The lymphatic system returns interstitial fluid and leaked plasma proteins back to the blood by using the lymphatic vessels. The lymphatic vessels are an elaborate network of drainage vessels, and they circulate approximately 3 liters of interstitial fluid per day. And then once the interstitial fluid enters the lymphatics, that is when it is called lymph. The lymphatic vessels can be found all throughout your body, and they offer a one-way system to ensure that lymph flows only towards the heart. The lymph vessels which make up the lymphatics include the lymphatic capillaries and the larger lymphatic vessels. Let's talk for a moment about the lymphatic capillaries. These are blind-ended vessels that weave between the tissue cells and the blood capillaries. They're pretty much everywhere in the body except for the bones, the teeth, the bone marrow, and the central nervous system. They're not found in the central nervous system because the central nervous system has its own method of drainage, and it uses the CSF, or the cerebrospinal fluid, for drainage. The lymphatic capillaries are similar to blood capillaries, except they are a lot more permeable. The lymphatic capillaries can also take up larger molecules and particles that the blood capillaries simply cannot. For example, the lymphatic capillaries can take up proteins, cell debris, pathogens, and even cancer cells. And they can act as a route for pathogens or cancer cells to travel throughout the body. They also have increased permeability due to 2 specialized structures. First, we're going to talk about the mini-valves. The endothelial cells, which overlap loosely, form these one-way mini-valves. And the mini-valves are anchored by collagen filaments to the matrix. So increases in the extracellular fluid volume opens the mini-valves even more, and decreases in the extracellular fluid can cause the mini-valves to close. The lymphatic capillaries also have what are called lacteals, and lacteals are specialized lymph capillaries present in the intestinal mucosa. And the whole purpose of the lacteals is to absorb digestive fat and deliver fatty lymph known as chyle to the blood. Now let's move on to the larger lymphatic vessels. The larger lymphatic vessels consist of what are called collecting lymphatic vessels. These consist of different vessels, different trunks, and different ducts. They have structures and tunics similar to veins, except they have thinner walls than veins, and they have more internal valves than the veins do. And they also anastomose more frequently. The collecting vessels in the skin travel with the superficial veins, but the deep vessels travel with the arteries. The lymphatic trunks are formed by a union of the large collecting vessels, and they drain large areas of the body. And they are named for the particular area of the body which they drain. For example, there are paired lumbar lymphatic vessels. There are paired bronchomediastinal lymphatic vessels, paired subclavian lymphatic vessels, paired jugular trunks, and the single intestinal trunk. These are all different examples of the lymphatic trunks, which are formed by the union of the largest collecting vessels. And again, they drain the large areas of the body which they correspond to in anatomical fashion. Lymph is delivered from the trunks into one of two large lymphatic ducts. The right lymphatic duct drains the right upper arm and right side of the head and the thorax. The thoracic duct is responsible for draining the rest of the body. Each of the ducts empties lymph into the venous circulation at the junction of the internal jugular and the subclavian veins on its own side of the body, respectively. When there is a problem with the lymphatic system, many different pathologies can arise. For example, a pathology known as lymphangitis, which is a condition in which the lymphatic vessels appear as painful red lines under the skin, can occur. Lymphangitis is caused by inflammation of larger lymphatic vessels that contain vasovassora. Vasovassora is a network of small blood vessels that supply the walls of the large blood vessels, such as the elastic arteries, for example, the aorta, and the large veins, for example, the vena cava. The name derives from Latin meaning the vessels of the vessels. And what happens basically is the vasovassora becomes congested with blood, and the larger lymphatics, like blood vessels, receive their nutrients from the branching vasovassorum, and it gives rise to these red demarcations of the skin. The lymphatic system is a low pressure system very similar to the venous system, and lymph can be propelled throughout the body by many different mechanisms. For example, the milking action of skeletal muscle. When skeletal muscle is undergoing contraction and relaxation, this can propel lymph through the body. If there are any type of pressure changes in the thorax during breathing, if there are any pulsations by nearby arteries, that could also contribute to moving lymph throughout the body. And also, if there are any contractions of smooth muscles in the walls of lymphatics, that can propel lymph as well. Please note that physical activity increases the flow of lymph, and those people who have sedentary lifestyles tend to have a slower lymphatic flow rate throughout their body compared to those who have a more active lifestyle. Lymphedema refers to swelling that generally occurs in one of your arms or legs, but sometimes both arms or both legs will experience swelling. Lymphedema is caused by anything that prevents the normal return of lymph to the blood. For example, in cancer patients who have tumors, the tumors may be blocking the lymphatics, or if the patient underwent a specific surgery to remove their cancer, the surgeon may have removed some of the lymphatics during the cancer surgery, which could result in lymphedema. And lymphedema may improve if some lymphatic pathways remain and enlarge. Lymphoid cells consist of both immune system cells, which are found in the lymphoid tissue, and supporting cells that form the lymphoid tissue structure. Please take a moment to look at this picture here, and please note that although both the myeloid cells and the lymphoid cells originate from the same source, being the hemocytoblast, their terminal differentiations are very, very different. The myeloid stem cells will differentiate into the neutrophils, the basophils, the monocytes, the eosinophils, and the macrophages, while the lymphoid cells will differentiate into the T lymphocytes, which are also known as T cells, and the B lymphocytes, which are also known as B cells. And both the T and the B lymphocytes are cells of the adaptive immune system, and they play a vital role in fighting infection. Both the T and the B cells protect against antigens. Antigens, again, remember, they are anything that the body perceives as foreign, such as bacteria, toxins, viruses, and cancer cells. And the T cells are really important for managing the immune response. And some of the T cells also have the capability to attack and destroy the infected cells. The B cells, which arise from the bone marrow, produce the plasma cells, which secrete antibodies. And remember, antibodies mark the antigens for destruction via phagocytosis or other means. Both the macrophages and dendritic cells are classified as other lymphoid immune cells. The macrophages are responsible for phagocytizing foreign substances, and they help to activate the T cells or the T lymphocytes. And you can see the representation of the macrophages and the dendritic cells in the picture on the left-hand side of the screen. The dendritic cells capture antigens and deliver them to the lymph nodes, and they also help to activate T cells. So the macrophages and dendritic cells have a common role as they both help to activate the T cells. And then on the right-hand side of the screen, you'll see what are called reticular cells. Reticular cells produce reticular fibers called stroma in the lymphoid organs. And the stroma is a network-like support that acts as a scaffolding for immune cells. And the main functions of the lymphoid tissues are to house and provide proliferation sites for the lymphocytes. And they offer surveillance vantage points for lymphocytes and macrophages as they filter through the lymph. Lymphoid tissue is largely composed of reticular connective tissue, which is a type of loose connective tissue. And the macrophages live on the reticular fibers. And the spaces between the fibers offer a place for the lymphocytes to occupy when they return from patrolling the body. There are two main types of lymphoid tissues, the first being the diffuse lymphoid tissue, and the second being the lymphoid follicles, also known as lymphoid nodules. Lymphoid organs are also grouped and classified into two functional categories, the first being the primary lymphoid organs and the second being the secondary lymphoid organs. But let's begin this discussion on the lymphoid organs and talk about the diffuse lymphoid tissue. The diffuse lymphoid tissue consists of loose arrangements of lymphoid cells and some reticular fibers. Diffuse lymphoid tissue is found in virtually every body organ, and there are larger collections of diffuse lymphoid tissue in the lamina propria of the mucous membranes. The lymphoid nodules, or lymphoid follicles, are solid spherical bodies that consist of tightly packed lymphoid cells and reticular fibers. They may contain germinal centers of proliferating B cells, and they may also form part of the larger lymphoid organs, known as nodes. And there are isolated aggregations of these found in specific body regions, such as the Peyer's patches in the intestine and in the appendix as well. And as we mentioned, the lymphoid organs are grouped into two categories. So let's begin by talking about the primary lymphoid organs and what constitutes a primary lymphoid organ. These are areas where both the T and the B cells mature. Remember, the T cells mature in the thymus, and the B cells mature in the red bone marrow. Both the T and the B cells originate in the bone marrow, but only the B cells mature there. Remember, the T cells mature in the thymus. So the regions of maturation are very important to understand and to know. The secondary lymphoid organs are areas where mature lymphocytes first encounter their antigen and then they become activated. Examples of secondary lymphoid organs include the nodes, the spleen, the MALT, which is the mucosa-associated lymphoid tissue, and other diffuse lymphoid tissues as well. The lymph nodes are the principal secondary lymphoid organs of the body, and there are hundreds of nodes found throughout the body. Most of the nodes are named in correspondence with their anatomical location. For example, in the cervical area, you have the cervical lymph nodes. In the axillary area, you have the axillary nodes. And in the inguinal area, you have the inguinal nodes. Most are embedded deep in the connective tissue in clusters along the vessels, but some are nearer to the body surface, like those depicted in the picture here. There are two main functions of lymph nodes. First, they cleanse the lymph. They act as the lymph filters. Macrophages help to remove and destroy microorganisms and debris that enter the lymph. and they prevent unwanted substances from being delivered to the blood. And the second main function of the lymph nodes is to activate the immune system. They offer a place for the lymphocytes to become activated and mount an attack against antigens. Now let's talk about the structure of a lymph node. Lymph nodes generally vary in shape and size, but most are bean-shaped, and they're pretty small. They're less than 2.5 centimeters, or they're approximately 1 inch. They're surrounded by an external fibrous capsule, and the capsule fibers extend inward as trabeculae that divide the node into compartments. There are two histologically distinct regions of the lymph node, the first being the cortex and the second being the medulla. The cortex can be divided into the superficial area and the deep cortex. The superficial area contains follicles with germinal centers that are heavy with dividing B cells, and the deep cortex houses T cells that are in transit. Remember, T cells circulate continuously among the blood, the lymph nodes, and the lymph. And there are abundant numbers of dendritic cells which are closely associated with both T and B cells that can be found in the cortex. And these play a role in activating both lymphocytes. In the medulla, there are what are called medullary cords, and the medullary cords extend inward from the cortex and contain T cells, B cells, and plasma cells. There are also lymph sinuses that are found throughout the node, and the lymph sinuses consist of large lymphatic capillaries spanned by crisscrossing reticular fibers. And you can also find macrophages, and macrophages, remember, they're residing on the fibers and they're checking for and phagocytizing any foreign matter that may be present. As lymph enters and circulates through the lymph node and then exits, it follows a very specific path. Lymph enters the convex side of the node through the afferent lymphatic vessels, afferent. And it travels next through the subscapular sinus and then into the smaller sinuses, which are found throughout the cortex and the medulla. From there, the lymph enters the medullary sinuses, circulates through, and then finally it exits the concave side at the hilum through the efferent lymphatic vessels, efferent. I remember the exit is associated with the efferent because exit begins with E and efferent begins with E. So the efferent lymphatic vessels, that is where the lymph is exiting the lymph node. And the presence of fewer efferent vessels causes the flow to somewhat stagnate, which is very important to allow the lymphocytes and macrophages time to serve their particular functions. When there is a homeostatic imbalance of lymph circulation, different pathologies can arise. For example, as you can see in this picture here in the axillary region, this man has a swollen area. This swollen area is known as a bubo, and these are inflamed, swollen, tender lymph nodes that result when the nodes are overwhelmed by what they are trying to destroy. The condition is often referred to as swollen glands, and the buboes can sometimes be filled with pus, and the bubonic plague was named after the chief clinical features of this disease. Another important clinical feature to be aware of when we talk about lymph nodes is that lymph nodes can become secondary cancer sites if metastasizing cancer cells become trapped in the node. This is one of the reasons breast cancer is so dangerous, and breast cancer is nothing to be taken lightly. If you look at the amount of lymphatics in the breast alone, and if you look at the regions the breast lymphatics drain to, they drain to basically all parts of the body. So cancer from the breast can metastasize basically anywhere. And this is very concerning, so breast cancer should be taken with the utmost level of sincerity and be treated as soon as possible. Cancer-infiltrated lymph nodes are swollen, but they're usually not painful. And this is a fact that helps distinguish cancerous nodes from those infected by microorganisms. The nodes that are infected by microorganisms are going to be painful, while those affected by cancer are going to be not painful. The spleen is a blood-rich organ about the size of your fist, and it's located in the left side of the abdominal cavity just below the stomach. It's the largest of all the lymphoid organs, and it's served by the splenic artery and splenic vein, which enter and exit at the hilum. The spleen serves as a site of lymphocyte proliferation and immune surveillance and response. It also aids in cleansing the blood of aged blood cells and platelets. And the macrophages located within the spleen help to remove cellular debris. There are three additional functions of the spleen which I want you all to be aware of. First, it stores breakdown products of red blood cells, such as iron, for later reuse. Second, it stores blood platelets and monocytes for release into the blood when they are needed. And third, it may be the site of fetal erythrocyte production. Please note that the spleen is encased by a fibrous capsule and also has trabeculae. Histologically, the spleen consists of two components, the first being the white pulp and the second being the red pulp. The white pulp is the site where the immune function occurs. The white pulp contains mostly lymphocytes on reticular fibers, and white pulp clusters are found around central arteries, and they appear as islands of white in a sea of red pulp. The red pulp is the site where old blood cells and blood-borne pathogens are destroyed. The red pulp is rich in red blood cells and macrophages that engulf them. Remember, the red blood cells have a lifespan of approximately 100 to 120 days, and the macrophages will engulf the red blood cells that are either reaching the end of their lifespan or any red blood cells that are deformed or have any type of irregularities to them. The red pulp is composed of splenic cords that separate the blood-filled splenic sinusoids. The spleen has a thin capsule, so any direct blow or severe infection may cause it to rupture, which will in turn lead to blood spilling into the peritoneal cavity. A splenectomy is the surgical removal of a ruptured spleen. Splenectomy was once the standard treatment to prevent hemorrhage and shock, but it has been discovered that the spleen can often repair itself. If the spleen must be removed, the liver and bone marrow take over most of its functions, and amazingly, in children younger than 12, the spleen will regenerate itself if a small portion of it is left. MALT stands for mucosa-associated lymphoid tissue, and MALT can be found in mucous membranes throughout the body, and it protects the body from pathogens that are trying to enter it. It can be found in the respiratory tract, the genitourinary organs, as well as the digestive tract. However, the largest collections of MALT are found in the tonsils, the Peyer's patches, as well as the appendix. The tonsils are the simplest of the lymphoid organs, and they form a ring of lymphatic tissue around the pharynx and appear as swellings of mucosa. And the tonsils are named according to their anatomical location. For example, the picture on the far left-hand side of the screen is a picture of the palatine tonsils, which are located at the posterior end of the oral cavity. The palatine tonsils are the largest of the tonsils, and they are the ones that are most often infected. So if you've experienced tonsillectomy, or if you know somebody who had their tonsils removed, they most likely removed the palatine tonsils due to their high susceptibility to infection. The lingual tonsil is a lumpy collection of follicles at the base of the tongue. The pharyngeal tonsil, also known as the adenoids, is located in the posterior wall of the nasopharynx. And the tubal tonsils surround the openings of the auditory tubes into the pharynx. The main function of the tonsils is to gather and remove pathogens in the food or the air, and the tonsils contain follicles with germinal centers and scattered lymphocytes. As depicted on the right side of the screen are Peyer's patches, which are aggregated lymphoid nodules found in the distal portion of the wall of the small intestine. They're structurally similar to tonsils, and they help to destroy bacteria and prevent the bacteria from breaching the intestinal wall. And they're also responsible for generating what's called memory lymphocytes, which aid in future immune responses. The appendix is a small organ which is attached to the large intestine in the lower right side of the abdomen, and it contains a large number of lymphoid follicles. And contrary to popular belief, the appendix does serve a function. Its functions are very similar to those of Peyer's patches. The appendix helps to destroy bacteria and prevents the bacteria from breaching the intestinal wall. And the appendix also has the capability to generate memory lymphocytes to help in the immune response. The thymus is a bilobed lymphoid organ found in the inferior neck, and it extends into the mediastinum and partially overlies the heart. The thymus functions as the lymphoid organ where T cells mature. And the thymus is most active and largest in size during childhood. It stops growing during adolescence and then gradually atrophies in adulthood and as we reach elderly ages. Please note that throughout the lifespan, the thymus still produces immunocompetent cells, though as we age, it produces them more slowly. The thymus is broken into lobules that contain outer cortex and inner medulla. The cortex contains rapidly dividing lymphocytes and scattered macrophages. The medulla contains fewer lymphocytes and thymic corpuscles. The thymic corpuscles are where the regulatory T cells develop. The regulatory T cells are a specific type of T cell that helps to prevent autoimmunity from occurring. The thymus differs from other lymphoid organs in three important ways. First, it has no follicles because it lacks B cells. Second, it does not directly fight antigens. It functions strictly in T lymphocyte maturation. It contains the blood-thymus barrier, which keeps immature T lymphocytes isolated from any antigens to prevent premature activation from occurring. And third, its stroma is made up of epithelial cells, not reticular fibers. And the stroma of the thymus provides the environment in which T lymphocytes can become immunocompetent cells. We will conclude our discussion of the lymphatic system by briefly mentioning some developmental aspects of the lymphatic system. The beginnings of the lymphatic vessels and main clusters of the lymph nodes are seen by week 5 of embryonic development, and they arise as lymph sacs from developing veins. The jugular lymph sacs specifically arise to form the right lymphatic duct and the thoracic duct. All of the lymphatic organs except for the thymus arise from the mesoderm. The thymus arises from the endoderm, and it forms as an outgrowth of the pharynx. Except for the spleen and the tonsils, the lymphoid organs are poorly developed at birth. After birth, high numbers of lymphocytes appear, and their development parallels the maturation of the immune system.